Assalamualaikum and hi everyone. Today our group is going to present about chronic glomerulonephritis. Greetings to Dr. Wan NURFARAHIN and Dr. Wan ROHANI. Glomerulonephritis or Bright's disease is an inflammation of the tiny filters in the kidneys called glomeruli. Glomeruli is the microscopic structures in kidney that remove excess fluid, electrolytes and waste from bloodstream and pass them into urine. Glomerulonephritis can be classified as acute that can come suddenly or chronic that can develop gradually. Generally, chronic glomerulonephritis is a kidney disease that characterized by long-term inflammation and scarring of the glomeruli. It usually develops slowly over years. It may not produce symptoms at the outset and can cause irreversible damage to kidneys that will lead to complete kidney failure. Chronic glomerulonephritis doesn't always have a clear cause. However, it can arise either from genetic disease, hereditary nephritis, exposure to hydrocarbon solvents, history of cancer, and also immune diseases. Symptoms of chronic glomerulonephritis include blood and protein in urine, high blood pressure, ankles and face swelling, frequent nighttime urination, bubbly or foamy urine, abdominal pain, and also frequent nosebleed.
Assalamualaikum warahmatullahi wabarakatuh. My name is BINTI ISMADI and I will explain about the pathogenesis of chronic glomerulonephritis. The pathophysiology of chronic glomerulonephritis begins with inflammation. This leads to injury to the glomerulus. As this occurs, the glomerular capillary become inflamed, which in return causes mild proteinuria, mild hematuria, and accumulation of the cell, which causes blockage. This blockage leads to decreased GFR, which lead to the increase of blood pressure, oliguria, edema, and malazotemia. The reduction in nephron mass from the initial injury reduces the GFR. This reduction leads to hypertrophy and hyperfiltration of the remaining nephron. These changes occur to increase the GFR of the remaining nephrons, therefore minimizing the functional consequences of the nephron loss. These changes are very dangerous because they lead to glomerulosclerosis and further nephron loss. Accumulation of the toxic waste products such as uremic toxin affect virtually all organ systems.
I'm going to talk about the mechanism of injury in the chronic glomerulonephritis. The obstruction of the blood flow will produce the secondary tubular atrophy, interstitial fibrosis, and thickening of the arterial wall by the hyaline deposits. In the interstitium is present an abundance of inflammatory infiltrates, mostly with the lymphocyte, and this will trigger the immunopathogenesis, which will lead to inflammation by the secretion of the cytokines. The inflammatory process can be self-healing and may result in continued additional injury. For instance, the cytokines release will lead to phagocyte recruitment and also the formation of the membrane attack complex, or also we known as the MAC, and this will cause further damage to the glomeruli. The generation of the pro-inflammatory cytokines and the complement products in turn will result in the proliferation of the glomerular cells. The progressive loss of glomeruli and nephrons will eventually lead to chronic glomerulonephritis from the acute condition. Depending on the stage of the disease, they may present different stages of the hyalinization or the scarring we call. The hyaline is an amorphous material, pink, homogeneous, resulted from the combination of the plasma proteins, increase the messenger matrix, and also collagen. Totally hyalinized glomeruli are atrophic, which is smaller, leaking of the blood capillaries, and this will make the glomeruli non-functional.
Today I'll be explaining about the histology and morphology of glomeruli. Glomerulus is a network of capillaries that lies in the Bowman's capsule, and the function is to filter blood and remove waste product through urine. So there are a few important structures that makes up the glomeruli. First of all, we have glomerular capillary. The glomerular capillary that lies near the Bowman's capsule involves in blood filtration. As you can see in this image, the inner layer of glomerular capillary is lined by endothelial cells, whereas the outer layer is lined by podocytes or epithelial cells. And glomerular capillary is surrounded by mesangial area, which is made up of mesangial cells and mesangial matrix. The function of mesangial area is to provide support to the glomerular capillary. And there is a single layer of glomerular basement membrane which separates the endothelial cells from the epithelial cells. For histology, glomerular tissue can be stained using several types of stains. First, we have H&E staining. Here we can observe the purplish color nucleus of the peripheral epithelium cell of the Bowman's capsule. Under Mason's trichome staining, we can observe the lobules and mesangial areas. This also shows the Mason's trichome staining, but under a higher magnification. So here we can observe the nucleus. It is stained in purplish color, whereas the mesangial cells are stained in bluish color. The final image here shows the methamine silver staining under 1000 magnification. So here we can observe the single layer of glomerular basement membrane which separates the endothelial cells and epithelial cells. That's all from me, and thank you.
And now I will talk about histopathology of chronic glomerulonephritis. Chronic glomerulonephritis is a chronic renal failure with small contracted kidney. It can be characterized by long-term inflammation and scarring of glomeruli. In terms of macroscopically, the affected kidney are small and there is presence of glandularity at the external surface. And there is also a scarring result from nephrin hyalinization. Microscopically, the characteristic that can be seen on chronic glomerulonephritis tissue are hyalinization, interstitial fibrosis, inflammatory infiltrate, thickening arteriole, and also tubular atrophy. The first characteristic is hyalinization. Hyalin is an amorphous material. Pink results from combination of plasma protein, and this includes messenger matrix and collagen. To identify hyalinization of the tissue, there must be a presence of eosinophilic, a glassy structure, and also homogeneous. Different degree of hyalinization will appear in the tissue section depends on the stage of the disease. If total hyalinization appear in the tissue, it means that it is an atrophy and has lack of capillary. This indicates that it is not functional anymore. Based on figure 1.0, it can be seen that there is a presence of total hyalinization and partial hyalinization of glomeruli. And in figure 4.0, we can observe the hyalin cast in between the dilated tubules. The next characteristic is pre-inflammatory infiltrate. Predominantly mononuclear inflammatory cells infiltrate with few neutrophils are present. It occurs when inflammatory cells such as neutrophil, eosinophil, macrophage, mast cell is infiltrate around the blood vessel.
Next is tubular atrophy. Obstruction of blood flow will produce secondary tubular atrophy, interstitial fibrosis, and thickening of the arterial wall by hyaline deposit. Tubular atrophy was defined by the presence of tubular epithelial lining, pycnotic nuclei, or tubular dilation, and with thickened tubular basement membrane. Figure 6.0 shows glomerulosclerosis seen in left lobar field and tubular atrophy with chronic inflammatory infiltrate. Tubular atrophy was significantly corrected with serum creatinine, creatinine clearance, as well as ability to concentrate and acidify urine. Figure 7.0 shows atrophic renal tubule was observed with chronic inflammatory infiltrate and hemorrhage in fibrostroma. Next is interstitial fibrosis. Interstitial fibrosis is the result of accumulation of collagen, which may result from a normal wound healing response becoming deregulated with an uncontrolled inflammatory response, characterized by the destruction of renal tubule and interstitial capillaries, as well as by accumulation of extracellular matrix protein. Interstitial fibrosis can be seen in the figure 8.0, which shows kidney destruction and compartment in health and disease.
All in all, glomerulonephritis is the inflammation of the tiny filters called glomeruli in kidneys. Signs and symptoms of glomerulonephritis depend on whether one have the acute or chronic form and the cause. Pathophysiology of chronic glomerulonephritis is mainly due to the progression of injury of the blood vessel that begin with the acute glomerulonephritis. In normal glomeruli, blood enters through the afferent arteriole. Blood filtration occurs in capillary walls towards the Bowman's capsule. The afferent arterioles converge to form efferent arterioles through which filtered blood exits the glomerulus. Histopathologically, chronic glomerulonephritis is characterized by the presence of interstitial fibrosis, hyalinization, tubular atrophy, inflammatory infiltrate, and the thickening of the arterial wall. Thank you for your time and thank you for listening. With that, we thank you.